Hi, everyone. Thank you for joining me today. My name is Karolina Molecka. I'm a licensed esthetician laser specialist at Fulcrum Aesthetics. I'm going to wait just a minute just to let some people trickle in. All right. I'm going to go ahead and get started. So thank you again for joining me for the Fall Skin Reset Masterclass. If you spent your time on a boat, at the pool, out in the sun this summer, this is the masterclass for you. Alrighty. So what I'm going to cover today, I'm going to go over summer sun damage, pigmentation, chemical peels, laser season preparation, along with some medical grade skincare. Alrighty, so summer sun damage. Sun damage is basically your skin's response to years of UV exposure adding up over time. So think months, years, even decades sometimes. So when we're talking about treating sun damage, we're not just treating what happens this summer, we're treating years of accumulated exposure that's finally showing up. Every unprotected exposure adds to a bank. So think any sunburns, walking your dog without using your SPF, sitting by a window, tanning, even without a burn, they all count. And it shows up as more than just spots. Think uneven tone, broken capillaries, that dull, tired look, and not just those hyperpigmented dark spots. So basically, when UV rays hit your skin, your body sees it as an injury, and then it kicks into defense mode. So it wraps up pigmentation, so think tan skin and sunspots, while also breaking down collagen and elastin over time. So why do people still tan or get pigment even with SPF? And I get that question a lot. So no sunscreen blocks 100% of the UV. So the remaining percentage still hits your melanocytes and it does add up over hours, days, and years in the sun. SPF is still protecting you and it dramatically reduces the damage, but melanocytes are still more active in some people than most people realize, which is why some pigment can still sneak through. Pigmentation. So pigment can sit in different layers of the skin, and that's why the key factor is why some sunspots respond faster to treatments and others don't. So epidermal pigment is going to sit on the top layer. Dermal pigment has dropped deeper into the dermis. Mixed pigment, both layers are involved. It's pretty common in melasma or pigment that hasn't been treated over a long period of time. Triggers aren't just UV, so they can be triggered by pigment can be triggered by any hot classes, hot yoga, hot Pilates, saunas, infrared, hot showers, and sometimes exercise. Chemical peels and lasers, along with a really good at-home routine, can help lift unwanted pigment. So here is a picture of epidermal versus dermal hyperpigmentation. So epidermal is going to sit on the top layer of the skin. It's much easier to treat with peels, lasers, um, even at-home skincare. And then dermal pigment has dropped deeper into the dermal layers of the skin. So it's a little bit harder to treat. More treatments are needed. So think series over a longer period of time. So chemical peels are so underrated, and I tell everybody get a peel once a quarter, once every 6 to 8 weeks. It's just such a game changer. So chemical peels use targeted acids to exfoliate any of that damaged layer of skin. It helps speed up cell turnover to reveal more even toned skin. So there are two main peels that we offer here at Fulcrum, the PCA peels and deeper, more downtime VI peels. So the PCA peels are going to be more superficial. They're minimal to no downtime, really great for maintenance, brightening, and also keeping the skin in a really healthy place. and keeping the skin in a good place in between bigger treatments. A VI peel is a medium depth peel and it goes deeper into the papillary dermis. So it is a stronger blend of acids that causes visible peeling over a period of 3 to 5 days, sometimes even 7 days. And it's more so targeted for more correction. So think sun damage, fine lines, uneven tone, acne, and melasma. Peels are a really great way to get you ready for laser season. So think of peels as your pre-season training and then your lasers as the big game day. So, what is laser season and why is fall actually the best time to treat? So, first, there is less UV exposure, so that means less risk of rebound pigmentation. So, we don't really have to worry about getting invited to a pool or a boat or anything like that. Second, the downtime is much easier to hide, so we're wearing scarves, we're kind of covering up a little bit more. It's not as bright out throughout the day. And then third is fall. Fall is actually when you treat the damage from the summertime, so we can be a little bit more aggressive, and then you can see visible results and better skin, by holiday parties and New Year's Eve, and you're ready to see everybody. And also healing works with your schedule instead of against it. So you're sweating less, there's less humidity, and fall is just a really great time to get your skin back in order. So Moxie is a really great laser to start with or to have in your repertoire of treatments. So Moxie is a 1927 non-ablative laser, and it's attracted to water in the skin, but also really loves treating pigment. So it's non-ablative. It means that it's not vaporizing the skin surface like a CO2 would, but it is creating those tiny controlled columns of thermal injury while leaving the surrounding tissue intact. So it is stimulating collagen production. It's helping with your tone, your texture, your overall radiance. And there is minimal downtime because the thermal energy is just concentrated. So think 48 hours of that redness, that pinkness. It feels like a sunburn, but totally manageable. And you can do the treatment all year round, but it's great to do in the fall. So preparing for your laser appointment, we don't want any suntan or spray tan or sun exposure for 2 weeks prior. Stop any of your retinols or actives. So actives meaning any AHAs, exfoliation, and then no antibiotics for the last 2 weeks. And you can use skin nectar to prepare your skin and get it ready, or do a peel a month before. So your aftercare, no sun exposure for 2 weeks after, no working out or makeup for those first 48 hours. An aftercare is always provided, an aftercare kit is always provided for you. And you can add on PRP or any of our topicals, such as Tuscany topical, PDGF. If you wanted to take something home with you, the Elastin Skin Nectar is great. And that's really awesome to get because you can not only pre-treat before your laser, but you can also use it after, or plated exosomes. Think of it as, taking that PRP home with you. So like I mentioned, 48 hours of that redness, up to a week of that sandpapery skin. So you'll feel really dry, but it's manageable and you're the only one that can see to the naked eye. No one's going to look at you and think, oh, they had a laser this past week. Be gentle and no picking. You absolutely want to protect your investment. So I will die on this hill. If you're not using good skincare at home, your treatments in office won't last as long and your results won't be as good as they can be. So SPF, retinol, vitamin C, brightener, and if you want to get crazy, throw in a growth factor. But those are your main ingredients, main products that you want to be using, especially if you're prone to hyperpigmentation, you want to be using a brightener. So our Koji Edit pads are absolutely amazing. You can pre-treat with those and use them post your treatment. So a series of 3 is always recommended, spaced 4 weeks apart. It allows us to build on each treatment, targets deeper layers of damage, and then those results will continue to compound over time. The 4 week interval is intentional. It really gives your skin enough time to renew itself and then be ready for your next laser. And then full results are typically seen about 4 to 8 weeks after your last session, but you will continue to see results after each treatment. And then most patients come back once or twice a year, but people really love Moxie, so they're doing it, quarterly. So this is one of my patients. We did two Moxies here. We also added BBL, which is such a great laser to add to Moxie, a combo treatment. You'll get better results with that too. So her hyperpigmentation really lightened, and she just looks beautiful. Her skin and texture look really great after. Here's another one of my patients. We did two Moxies here. So you can see she does have melasma, but it really helped clear it up. So Moxie's really great for melasma. We also added BBL to this one too. And then what you can expect after Moxie. So this is me immediately after. You're going to feel spicy, you're going to feel warm, you're going to feel hot. 24 hours post, it feels like a little bit of a sunburn. This is 48 hours post. I just have sunscreen on all of these, and then 72 hours post. So those little mends, those coffee grounds are going to come to the surface. And it just looks more like a little suntan after. But this is what you can expect. So nothing crazy, nothing that you have to like hide from people. And especially in the fall, we're not really worried about that UV exposure. Okay, so um, I am here for any questions if anyone has any. Give me just 1 second. Perfect. All right. So this is a really great question. Can I do a BBL and chemical peel at the same appointment? Absolutely. I feel like it is a case by case base on a case by case basis. If I've seen you before and we feel this is a great treatment for you, then absolutely we can move forward. But BBL and chemical peel is really beautiful. BBL is going to help with that pigment, give you overall clarity, and then the peel will just give you just help with that cell turnover and get rid of any of that dead skin. But that is a really great combo treatment. We could do BBL and VI peel same day. We can do BBL and PCA peel same day as well. And then what is my favorite product to pre-treat with? So I have two favorite products that I pre-treat with. The Koji Edit Pads, they have arbutin, salicylic, they're brightening, they're really great to just help brighten the skin. And the Elastin Nectar. Elastin Nectar eats up away any of that old collagen, any of that dead skin. And those are two really great hero products that we have for pre-treating with, and you can use them post-treatment as well. Can you wear tinted sunscreen post-treatment? So you can wear tinted sunscreen post-treatment about 24 hours post. I don't want you to use it right after because those microchannels stay open in the skin for up to 36 hours. So just wait like 24-ish hours and then you can use tinted sunscreen. My favorite tinted sunscreen is going to be the Elastin Hydra Tint. It almost acts as like a foundation too, which is awesome. Then you don't have to put any more makeup on. All right, so it looks like that's it for our questions. I just want to thank everybody for joining me today, and I really hope that you learned something new. As an appreciation for being here, I'm offering $300 off a package of three VI peels. So normally it's $1,200, discounted to $900, and or a package of three Moxies, $400 off for face and neck. Normally 2,400, it'll be 2,000 with me. You have to purchase by September 11th, and then you can include Fall Skin Masterclass in your booking notes, or you can text us or call us or DM me or scan the QR code. We make it pretty easy to schedule. And I would genuinely encourage you to grab both of these packages. They'll never expire after you purchase them, and they'll just sit in your patient wallet until you're ready to use them. VI Peels and Moxie is just a really beautiful combo treatment that you can do every month for the next 6 months. And it'll give you more dramatic results than just doing one treatment alone. And they work really well, combined together. So if you're on the fence, this is a really great time to do both. All right. Thank you so much, guys. Have a great day.